So today, we're going to tackle a topic that comes with a ton of questions. SSRIs. What are they actually doing inside your brain? How are they supposed to make you feel? And what are the really critical things that pretty much everyone should know? Let's dive in.
You've probably heard the classic explanation, right? The idea that depression is just a simple chemical imbalance, specifically not having enough serotonin in your brain. It's a neat and tidy idea that's been popular for a long time.
Well, here's the thing. That explanation, it's a huge oversimplification. It's not really the whole picture. Your brain is just so much more complex than that. So, if it's not just about cranking up a chemical, what is really going on when someone takes an SSRI?
To get that, first we need to take a quick look at how the brain's messaging system works, and it's actually a pretty cool process. I want you to think of it like sending a text message. One brain cell, that's a neuron, sends out a chemical messenger, in this case, serotonin. The next neuron in line picks it up, it receives the message. But, and this is the critical part, that message isn't supposed to just hang around forever. The first neuron that sent it actually sucks it back up in a process called reuptake. It's kind of like unsending the text right after it's been read, just to keep the line clear for the next message.
And this is exactly where SSRIs step in. I mean, the name itself tells you everything you need to know. Selective, serotonin reuptake inhibitor. It selectively inhibits, or blocks, the reuptake of serotonin. So by slowing down that reabsorption process, the serotonin message just gets to linger in that space between neurons for a little bit longer, making the signal feel stronger and more persistent.
Okay, but here's the most important point, and it's the part that most people miss. If the drug starts messing with serotonin levels on day one, why doesn't anyone feel better instantly? Why does it take weeks to kick in? Well, it's because that immediate chemical change, that's not the real goal.
This timeline right here, this shows you what's really happening. That initial chemical change on day one, that's just step one. The real effect comes from what the brain does in response. Over the next few weeks, your brain starts to adapt to this new normal. It actually begins this process of remodeling and rewiring itself. This remodeling, this is the real magic. The medication basically creates the right conditions for the brain to build healthier pathways. Neurons start to get more responsive. Key connections get stronger, and those circuits in your brain that are responsible for stress, they begin to calm down. There's even evidence that areas like the hippocampus, which can shrink from chronic stress, can show signs of rebuilding. So you see, it's not about a simple chemical boost. It's about helping the brain physically change itself. It's all about neuroplasticity.
So, okay, that's the biology. But what does all of this actually feel like for the person taking it? Because it's often not what people think it's going to be.
You know, a lot of people imagine a happy pill that's going to make them feel euphoric all the time. But that's just a myth. The much more common experience is a gradual turning down of the volume on all that mental noise and distress. It's really about creating stability, not some kind of artificial high. I think this quote just captures it perfectly for so many people. The whole point is to create enough mental breathing room to be able to function again. The looping, intrusive thoughts start to lose their punch. The emotional highs and lows aren't so extreme, and you finally get that split second to pause before you react. You still feel like you, just a version of you that isn't in a constant fight with your own mind.
And because serotonin is involved in so many different things in the brain, not just mood, but sleep, appetite, you name it, these medications are actually used for a whole range of conditions, not just depression. They're very commonly prescribed for anxiety disorders, OCD, PTSD, and a bunch of other issues that are rooted in how the brain's circuits are firing.
Now, we have to have the honest conversation. Because like any medication that actually works, SSRIs are not a free ride. There are potential side effects, there are risks, and it's absolutely essential to be informed.
A lot of the initial side effects, things like nausea or headaches, they often go away after a couple of weeks as your body gets used to the medication. But others, like sexual side effects or maybe a feeling of being emotionally muted, can sometimes stick around for some people. These are very real possibilities that you have to have an open conversation about with your doctor. And it is absolutely critical to talk about the FDA's black box warning. This is the most serious kind of warning they issue. It notes that there is a small but real risk of increased suicidal thoughts, particularly in adolescents and young adults, and specifically during the first few weeks of treatment. This is exactly why close monitoring by family and doctors is so vital when someone in this age group starts this medication. There are also some really important drug interactions to be aware of.
You can't combine SSRIs with certain other drugs, like a class of older antidepressants called MAOIs. That can be really dangerous. And for someone who might have an undiagnosed bipolar disorder, taking an antidepressant by itself can sometimes trigger a manic episode. That's why getting a thorough medical history is so important before starting.
And one final thing, you should never ever just stop taking these medications cold turkey. If you do, you can get something called discontinuation syndrome, which feels awful. Think dizziness, flu-like symptoms. A doctor will always help you taper off gradually and safely to avoid all that.
Okay, so let's zoom out. What's the role of an SSRI in the big picture of mental health? It's just so important to see it as one tool, just one piece of a much larger puzzle.
Look, SSRIs don't fix your life problems, and they don't teach you new ways to cope. What they can do is stabilize your mood and dial down the symptoms enough to give you that breathing room, the space you need to actually do the hard work in other areas, like therapy. I think of it this way. The medication can help you get back on your feet, but therapy is what teaches you how to walk in a new, healthier direction. The two really work best when they're together.
So after all of this, the science, the experience, the cautions, if you're going to remember just one thing about how SSRIs work, what should it be?
It's this. At their absolute best, SSRIs are a tool. They're not a personality transplant. They're not a magic happiness button. They are a neurobiological tool that can help quiet the mind, ease the pain, and create the space a person needs to start the work of rebuilding their own life. And that really leads to the most important point of all. Reading stuff online, trying to figure it all out on your own, that can only get you so far. If you're struggling, truly, the single most powerful and important step you can take is to have an open, honest conversation with a qualified doctor or therapist. They're the ones who can help you understand all your options and find the right path forward for you.